Hi, how are you? This is the next lecture in the Emergency Medicine Trauma Tutorial Student Session lectures. And what we're trying to do is allow you to understand what kind of resources are available to you in the emergency department and why we use them. We're here at Jacobi, and at Jacobi we are lucky enough to have a multi-place hyperbaric chamber, which has been here for quite a while. We actually have quite a bit of experience with it. It has been here since 1992, physically in this place, although this building was actually built around it because it's not really all that easy to move. So we started here by treating diving injuries, which is the primary reason that many people started with chambers. However, we've gone on to become very active in carbon monoxide poisoning, in all sorts of other appropriate uses as approved by the UHMS, the Undersea Hyperbaric Medical Society, for care for patients who need the chamber. We can actually treat 3 intubated patients, or we can treat 9 patients who are able to sit up during their treatment in this chamber. So it is significantly larger than the vast majority of chambers, like the monoplace chambers you may be more familiar with seeing. So the next chamber closest to us that's open 24/7, looking to treat emergencies as well, is actually all the way down in Philadelphia. And there's another chamber in Groton, Connecticut, an additional chamber up in upstate New York as well, in Syracuse. So there are other chambers around that are this big. However, most people are now using monoplace chambers because they're easier to set up. However, there are significant advantages to having a larger chamber. 2 of the major advantages to having a larger chamber is, let's say you have a fire where you have multiple members of the family that all have to be treated together. In this chamber, we're able to keep the family together. We don't have to separate the kids from the adults or anything along those lines. The other advantage is that we can actually go to greater depth. So this becomes very important when you talk about diving injuries, and specifically commercial divers, because they are the ones that tend to go to greater depth and perhaps have a greater need to go deeper to treat their beds. So what do you use it for? From the emergency department, we use it for carbon monoxide poisoning, is one of the options. So for carbon monoxide poisoning, why would you consider using a chamber? The reasons that you use a chamber, the indications include problems with either neurologic or systemic function that is secondary to carbon monoxide, along with a high carbon monoxide level at some point. So some of the systemic problems that can happen with carbon monoxide is you can actually have cardiac ischemia that is secondary to the carbon monoxide because it has a direct effect on the cardiac muscle. You can have neurologic effects, you can have coma, you can have stupor, you can have seizures. You can also have, because patients who are pregnant, fetal hemoglobin has a much higher affinity for carbon monoxide than does adult hemoglobin. And because of that, if you have a patient who has a level that's equivocal, who's pregnant, their fetus is actually getting a much greater hit from carbon monoxide. So our threshold drops a little bit for the pregnant patients. And then anyone who has over a level of about 20, we usually consider treating in the chamber. That being said, why do you use it? So one of the things that it does, the main thing it does actually in terms of carbon monoxide poisoning, is it actually decreases the half-life of CO in the chamber of the carboxyhemoglobin. So what would normally be a half-life of carboxyhemoglobin at ambient air would be about 300 minutes. On 100% oxygen, it would be 90 minutes, and in the chamber, it's 20 minutes. So if the level is very high, especially, which is why we consider level as part of what we do, this can be a real advantage in terms of taking care of the patient. What are some of the risks that are involved with being in the chamber? The risks of being in the chamber include basically barotrauma. So if you have a subtle pneumothorax that isn't considered ahead of time, the change in pressure can actually cause a much larger pneumothorax, and even a tension pneumothorax if it gets that big. You can have barotrauma to the face in terms of the sinuses. You can have barotrauma to the ears, where you can have a ruptured tympanic membrane. So we always get a chest x-ray before we put somebody in the chamber. We always look at the ears, and we explain to the patient as best as possible how they can clear their ears. Obviously, if the patient is intubated, that is limited. Other choices to use the chamber for, so decompression illness is another popular option, obviously, in terms of what emergent reasons there are to use the chamber. So for decompression illness, you can have something called the bends, which mostly means nitrogen bubbles in the tissue itself. Or you can actually have an air embolism where there's a large enough bubble somewhere, either within some portion of the arterial/venous system, that then causes its effect by causing ischemia on the other side of wherever that blood supply is supposed to be going to. The chamber is able to then, if you get patients in the chamber quickly enough, you can shrink the bubble size. By shrinking the bubble size, it allows the nitrogen to off-gas during the time the patient is being treated. The bubble location determines where the symptom is. So it can be a neurologic sort of effect, it can be a cardiac effect, it can be a specific area in terms of some area of tissue that is being affected, where you have ischemia because of the bubble being in place. The advantage, again, of our chamber is that perhaps you have a number of people that are on a dive. They come back from wherever it is that they're diving. And in New York, we have lots of people who go down to deep commercial dives. But clearly people also can come back from the Caribbean where they're out having fun and not maybe paying attention to dive tables. The risk factors for having issues in terms of diving illness include things like not paying attention to the dive tables appropriately, maybe diving more often than you should, going deeper than you should, not spending appropriate amount of time in terms of coming back up and decompressing as you come up. I want to thank you, and if you have any further questions about the hyperbaric chamber at Jacobi, we are more than happy to answer them. There is a group called DAN, which also has us listed in case there's any sort of diving injuries, the Divers Alert Network. We are certainly one of their participants, and we look forward to hearing from you guys. Take care.